You're dealing with strangers, you're giving them medicines, there's a lot of liability. But you know how you feel exhausted after a long trip? That would be that's a great way for any of us to get benefit. So what I'm trying to do is decide how to change the venue so that the membership cost, that is a very cool, right? So that the membership would go down for people who don't need supervision.
Right.
And maybe we can, I'm going to talk to Barbara and Sue about reducing that so people can come who are healthy and not have a nurse present and just use the place for, you know, some lower fee. And I don't know whether there's going to be 30 or 40 a month. I just got to figure that out. But I think that that would work because then I could have later hours and people who are working could come. But for people who need supervision, and the supervision doesn't have to be forever. It just has to be long enough so that we're certain that there's a broad margin of safety. Not that this is so vigorous that I think it's highly dangerous, but for some of the people it really can be. And there's some of the people who qualify because they're very ill or frail that we can actually justifiably bill their insurance as for physical therapy codes. But I don't like to do it for an extended period of time because I don't want to use up a Medicare person's physical therapy benefit. What if they injure themselves and need it later in the year? So I think the best thing is to keep the price low, let people understand these things, and go forward.
So again, you would just call the...
Yeah, a person like you could come in for a visit, we could just do the oxygenation study, and you could say, you know, it's worth it or it's not. The other thing that I think is true about the levels that we measure is they can vary to some degree through the day. So one of the things I'm going to try to do is get some volunteers who I could measure over time at my expense so that I know what's normative. I'm going to get some of my young office staff, my 20-plus-year-olds, but then I want to get some of my 60, 70-year-olds because I think when people, you know, you can wake up and feel pretty good, but there's a certain time of the day you feel terrible. Well, that's an interesting time to actually make these measurements, whether it's the pH, whether it's the venous O2 or the arterial O2, and also, interestingly, the blood sugar and the triglycerides. Because the blood can get real sticky at around 2 hours after you eat, sludgy, and you feel, you know. So if you know these things, you might guide diet a little bit more. But anyhow, that would be an interesting thing to do over time. Yes?
What is your feeling about fluoride? Because, I mean, I'm really researching a lot and considering getting the reverse osmosis. And is the water that you have got fluoride in it?
My home, no. I think here, yes, but we use bottled water, and frankly, I don't know what's in it. I could measure it again. But I don't know what to say about it. I don't know enough to give you an intelligent answer. There are people who feel very strongly about its dangers to the population at large, and from my perspective, there are many bigger, greater dangers. You know, whether it's the just excess eating in general, alcohol, drug, tobacco, the type of foods we eat, literally the other toxic products in our body that can have an adverse effect. There's a lot of people who are very worried about bromide, and I'm just not ready to take on any more worries.
So if you don't have fluoride in your water at home, is what you're saying?
Well, we're on well anyhow.
Oh, okay.
So the answer is no, but most people are one of the things I think, and I'm not an expert on this, but when you do the reverse osmosis, you create a water that has no minerals in it.
That's good.
So water with a little bit of calcium and magnesium, I think, has benefits. So what we have reverse osmosis, then we have a gadget that drips a little mineral in the water.
Really?
So, there's no end to the craziness, right? It's spy versus spy versus spy.
I know.
From that old cartoon.
Well, see, I think you probably have a good balance then, because at least you're having that at home, but, you know, whatever we're going to get out, and we do the best we can.
Yeah, I think so. You can't worry about those things all that much.
Yeah.
You know, because the magnitude of the public health hazard has not truly been, you know, it's not conclusive.
Okay, thank you.
Yeah.
Is that what Kangen water is? I mean,
The Kangen water is the gadget that someone talked me into buying for a lot of money. And it is I guess it cleans the water on the one hand, but also helps you control the pH on the other. So you can get an acid pH, which is very good for your skin, for cleansing. And you can get a neutral pH, and you can get like 8.5 pH, which apparently makes your coffee taste better. Or
9.5 or 10, which you could clean the spots off the floor.
yeah,
Off your carpet.
but I think it's a very expensive gadget, and you know, if you're really sick, I think it might be useful transiently. But to use it the rest of your life, I don't know. But it is available if you ever want to get a liter from our office. I don't charge for it.
So, Dr. Myers, when you were speaking about the Myers cocktail, is that the same products you have here listed for your support energy production?
No. Myers cocktail, there's a Dr. Myers, who's an old surgeon in
but
Baltimore.
you said that he used the magnesium and the,
In that, it's an intravenous push.
oh, that's intravenous. But
It
what you
has
have
B
here is oral.
vitamins. It has calcium, magnesium, and vitamin C. And there are people who, you know, when they're really feeling rotten, makes them feel much better.
It's also good for migraines.
It's good for migraine. The magnesium is a vasodilator, so when you dilate the area peripherally, you reduce the congestion in the head, and it does help migraine. But of course now we have FDA approval for Botox, so
Yeah, I
the sky's the limit.
The other question is apnea. How sleep apnea? Or
Yeah, now
how does
that's
this work with?
well, you know, it's a wonderful question, and the truth is I don't have a really learned answer. I think you should have your sleep apnea treated as effectively as possible. But you know, in my mind, while not everyone with sleep apnea has excess body weight, many people who have sleep apnea and excess body weight will improve dramatically with weight reduction. And so that's one thing people could do. And then, of course, there are all the different therapies that are available. But what I don't know is if you're desaturating at night frequently and repetitively, what value would the oxygen multi-step therapy have? And frankly, I don't know. But I do think it's a very interesting potential contributor to the normative age-related reduction in oxygen saturation, which I hadn't thought of until now, so I really appreciate you raising that. But I think it's something to really think about. Because I think as we get older, that may become a more prevalent problem. So your husband, he's skinny, does he snore? Huh?
Nuh-uh.
Now, does he snore?
I'm taking notes.
Is he a snorer?
What? Oh, am I a snorer? What? She doesn't hear very well, so
I'm just trying to track it. Let's take a break, and then we can get started in about another 10 or 15 minutes.
How are you?